Hello, my name is Lupe Yarborough. Currently, I'm a certified hand therapy assistant practicing in hand therapy. I am going to be going through range of motion and manual muscle testing assessment on a patient. I'm testing shoulder flexion. His shoulders in adduction, his forearm is in neutral position, and his palm is facing his body. His axis is going to be his humeral head. His shoulder, let me see. His shoulder is at 0 degrees. I'm stabilizing his superior shoulder. And I'm going to ask the patient to fully flex his shoulder. Go ahead. Shoulder flexion is 0 through 170 degrees. His shoulder flexion is 160. I'm testing shoulder extension. Patient is standing. His shoulder is in adduction. His forearm is in neutral position with his palm facing his body. I'm going to take his first measurement. I'm finding his axis, which is his humeral head, placing the fulcrum there, and he's starting at 0. Shoulder extension is from 0 through 60 degrees. Stabilizing his superior shoulder, and I'm asking the patient to extend his shoulder. Bring your arm back as much as you can. There. Sorry, you were substituting. So dumb. Here. His shoulder extension is 62 degrees. Relax your arm. I'm testing shoulder horizontal abduction, ABD. Patient is sitting. His shoulder is going to be in abduction, 90 degrees. His elbow is going to be extended and palm is facing down. I'm going to find his acromion process on his superior shoulder. And I'm going to place the fulcrum on it to check his starting position. Sorry for the goni on your face. And his starting position is 0. Range of motion for shoulder horizontal abduction is 0 through 40 degrees. Stabilizing closer to the neck on the shoulder. Go ahead and bring your arm back. Okay, hold it. I have the stable bar on his body, on his superior shoulder, and the movable arm is going towards his humerus. Relax. His range of motion is 20 degrees. I am testing shoulder horizontal adduction. Patient is sitting. Shoulder is going to be in 90 degrees. Abduction, elbow is in extension with palm facing down. I'm going to find his axis, which is the acromion process, superior of shoulder. I'm placing the fulcrum on his axis and taking his first measurement. He's starting at 0. Hold it there. Shoulder horizontal adduction range of motion is from 0 through 130 degrees. I'm stabilizing his shoulder closer to the neck. Now go ahead and bring your arm towards you in adduction. Swing it forward all the way that you can. If you want, you can bend your elbow. Go ahead and stay there. Sorry again. Okay, that's the stabilizing arm is on his body and the movable arm is going towards his humerus. Relax. His range of motion is 99. I'm testing elbow flexion. Patient is standing, his shoulders in adduction, his elbows in extension, his forearm is in supination, his palm is facing forward. I'm going to find his axis, and it's the medial epicondyle. I'm going to place the fulcrum of my goniometer and his starting position is, yes, thank you, is 0. Hold it. I'm going to have him, I'm going to stabilize his humerus, mid-humerus, and I'm going to have him flex his elbow. Go ahead, flex. Hold it there. Come on, come on. Let me see. All right. Okay, the stationary bar is on his humerus and movable arm is on his forearm. Elbow flexion range of motion is from 0 through 135 through 150 degrees. Relax, bring arm down. Jeez, I can't see. 20, 25. Got 128. Yes. Okay, I am testing forearm supination. Patient is standing. His shoulders in adduction. His elbow is going to be in 90 degrees flexion. His forearm is in neutral, and I'm going to have him holding a pen. Grab that pen. Okay. I'm going to find his axis, which is the third MCP of his digit. And I'm going to place the fulcrum with the stationary bar perpendicular to the floor and the movable arm parallel to the pen. His starting position is 0. Forearm supination range of motion is from 0 through 80 degrees to 90 degrees. I'm stabilizing his mid-humerus, and I'm going to ask the patient to rotate his forearm so his palm is facing up. Go ahead and rotate. Hold it there while I take your measurement. Patient is at 90 degrees. I am testing for forearm pronation. The patient is standing, shoulders in adduction. His elbow is going to be flexed at 90 degrees. His elbow is going to be flexed at 90 degrees. His forearm is in neutral position, and I'm going to have him holding a pen. I'm going to find his axis of rotation, which is his third MCP of his digit. And I'm going to put the fulcrum of my goniometer on the axis. And the stationary bar is perpendicular to the floor, and the movable arm is parallel to the pen. I'm going to stabilize his mid-humerus, and I'm going to ask him to rotate his forearm so his palm is facing the ground. Go ahead and rotate. Keeping your elbow next to your body. Thanks. Hold it there.
Form pronation, range of motion is from 0 through 80 through 90 degrees.
Relax. It's at 91 degrees. I am measuring his wrist flexion. His shoulder is adducted. His form is in neutral position and resting on the table. I'm going to find his axis, which is his styloid process of radius. I'm going to place the fulcrum of my goniometer on the axis. The stationary bar is on the radius, and movable arm is on the second metacarpal.
Wrist flexion, range of motion is from 0 through 80 degrees.
Here. Okay, I started at 0. I'm going to stabilize his form underneath his form, and I'm going to ask the patient to flex his wrist. Go ahead and flex for me. Hold it there. His wrist flexion measures 46 degrees. Okay. I am testing wrist extension. His arm is in adduction. His form is in neutral and resting on the table. Relax. I'm going to find his axis of rotation, which is his styloid process of the radius. I'm going to place the fulcrum of the goniometer over it, and the stationary bar is on the radius, and the movable bar is on the second metacarpal. And okay, starting position is 0. And I'm gonna stabilize, wait a minute. Thank you. I'm gonna ask the patient to extend his wrist, go back that way.
Wrist extension, range of motion is from 0 through 70 degrees.
Relax. Patient has 65 degrees of extension. Okay. I am testing ulnar deviation. Patient is sitting, shoulders in adduction, elbow is going to be flexed, and form is resting on the table in prone position. His wrist is in extension, in actually neutral, relaxed on table. His fingers are relaxed. And I'm going to find his axis, which is the base of his third metacarpal. I'm going to place my fulcrum on axis. The stationary bar is on his form, and movable arm is on his third metacarpal of his third digit, and his starting position was 0. I'm going to stabilize his form underneath, and I'm going to ask patient to ulnar deviate. Move your wrist that way. Hold it.
Ulnar deviation, range of motion is from 0 through 30 degrees.
His ulnar deviation is 35 degrees. I'm checking radial deviation. Patient is sitting, shoulder is in adduction, elbow is flexed, and form is resting on the table in pronation. His wrist is in neutral and relaxed on table. His fingers are relaxed. I'm going to find his axis, which is the base of his third metacarpal, and I'm going to place my fulcrum on it. Stationary bar is on forearm, and my movable arm is on his third metacarpal of the third digit. His starting position is 0. I'm going to stabilize underneath his forearm, and I'm going to ask patient to radial deviate his wrist. Go ahead and move it that way. Oh, go again. Try again. Stay there.
Radial deviation range of motion is from 0 to 20 degrees.
His radial deviation is 20 degrees. I'm taking the range of motion of MCP joint of the index finger. Patient is sitting, shoulders in adduction, elbow is flexed at 90 degrees, and forearm is resting on the table in neutral position. His wrist is also in neutral. His MCP is the axis. And I'm going to place the fulcrum on it with the stationary bar on his second metacarpal and the movable arm on his first phalanx. Starting position is 0, and I'm going to stabilize his wrist, and I'm going to ask the patient to bend his finger. Go ahead and bend. Just bend just your index finger. He's at 70 degrees. Come back.
Finger MCP range of motion is from 0 through 90 degrees.
I am testing the range of motion of the PAP joint of the index finger. Patient is sitting, shoulders in adduction, elbow is flexed, forearm is in neutral, wrist is in neutral, and fingers are going to be in extension. Go ahead and extend your fingers. The axis is the PAP joint. I'm going to put my fulcrum there, and the stable bar is on the proximal phalanx. The movable bar is on the middle phalanx. Starting position is 0 degrees, and I am stabilizing the MCP joint of the index finger. Now I'm going to have my patient flex his PAP joint. And his range of motion is 101. Relax. Motion for PAP joint is 0 to 110 degrees. I'm testing for range of motion of the DAP joint of the index finger. Patient is sitting, shoulders in adduction, elbow is flexed, forearm is in neutral, wrist is in neutral, fingers are in extension. I'm going to put the fulcrum over the joint, DAP joint. Stationary bar is over the middle phalanx. The movable bar is over the distal phalanx, and the starting position is 0. Stabilizing over the PAP joint, and I'm going to ask the patient to flex the DAP joint. Go ahead. His range of motion is 52. Relax. Range of motion for the DAP joint is 0 through 80 degrees. I am testing shoulder flexion against gravity. Patient is sitting, shoulder is adducted, elbow is extended and relaxed, forearm is pronated with his palm facing my body. I'm stabilizing his shoulder, and I'm palpating his anterior deltoid, and I'm going to ask patient to flex his shoulder. Come up. That's 3 minus. Come all the way. Stop there. That's 3 currently. I'm going to apply resistance distal to humerus. I'm going to ask patient to resist the push down at the count of 3. 3. 1, 2, 3. Don't let me push you down. 3 plus. 4, 5. Relax. Patient is 5 out of 5 muscle grade. I am testing shoulder flexion, gravity modified. Patient is laying on the table, sideline. Shoulders adducted, elbows is an extension. Relax. Forearm is in pronation with palm facing the window. I'm stabilizing his shoulder and I'm palpating anterior deltoid, and I'm having patient flex his shoulder to 90 degrees. Go ahead, patient, move your arm up.
2-.
He is currently at a level 2/5. Now I'm going to apply resistance distal of humerus. At the count of 3, I'm going to apply resistance. Don't let me push your arm down, okay? 1, 2, 3. Resist. 2+, relax. Patient is currently at a 2+/5 muscle grade. I'm palpating his anterior deltoid and I'm asking the patient to flex his shoulder to 90 degrees. Attempt to move your shoulder. There is no muscle contraction and no motion. He's at a level 0/5. I'm going to ask the patient to move his shoulder once again to 90 degrees. Go ahead and move your shoulder. There was a muscle contraction but no motion, so he's at a level 1/5. I'm testing muscle grade for shoulder extension. Patient is prone on table, shoulders in adduction, elbows relaxed, forearm is in pronation with palm facing up. I'm going to be stabilizing shoulder being tested. I'm going to be palpating the teres major. And I'm going to ask the patient to fully extend his shoulder. Go ahead and come on up. 3-. 3. Hold it. I'm going to apply resistance. Don't let me push you down. Okay, I count of 3. 1, 2, 3. Resist. 3+, 4, and 5. Relax. Patient is 5/5 muscle grade. I am testing shoulder extension with gravity modified. Patient is currently sideline on table. Shoulder is adducted, elbow is relaxed, forearm is in pronation with his palm facing back towards me. And I'm going to stabilize his superior shoulder. And I'm going to palpate his teres major. And I'm going to ask him to extend his shoulder back. Go ahead. Extend.
2-.
Currently is at a 2/5. Now I'm going to apply resistance to distal humerus. At the count of 3, resist it. Don't let me push you back where you were. 1, 2, 3. Resist. Don't let me push you. 2+. Relax. Patient is currently at a 2+. Gravity eliminated. I'm palpating his teres major and asking the patient to extend his shoulder. Go ahead and extend your shoulder. There is no motion and no muscle contraction. He's at a level 0/5. I'm going to ask the patient to move his shoulder again into extension. Go ahead and attempt to move. I felt a muscle contraction but see no motion. He's at a level 1/5. I'm testing shoulder abduction. Patient is sitting, shoulder is in adduction, elbows in extension. Forearm is in neutral, his palm is facing his body. I'm going to stabilize superior shoulder that's being tested. I'm going to palpate his middle deltoid and I'm going to ask him to abduct his shoulder. Bring your arm up. 3 minus, 3. Now I'm going to apply resistance. Don't let me push you down. I'm going to count to 3. 1, 2, 3. Resist. 3 plus, 4, and 5. Relax. Patient is 5 out of 5 muscle grade. I am testing for shoulder abduction, gravity modified. Patient is supine on table, shoulder is in adduction, elbows relaxed, form is in neutral with his palm facing his body. I'm stabilizing his superior shoulder being tested. I'm going to palpate his middle deltoid. I'm going to ask the patient to attempt to move his arm in abduction. Go ahead and attempt. There is no motion and no contraction. That's a 0 out of 5. I'm going to ask the patient to attempt to move his arm again. Attempt. There was no motion, but I felt a contraction. That's 1 out of 5. Now I'm going to ask the patient to move his arm again. Go ahead and attempt to move your arm. As a 2 minus. That's a 2. Now I'm going to apply resistance. Don't let me push you down at the count of 3. 1, 2, 3. Resist. 2 plus. Relax. Patient is at a 2 plus over 5. I'm going to be testing shoulder external rotation against gravity. Shoulder is abducted to 90 degrees, elbow is flexed at 90 degrees, and form is perpendicular to the floor, and his palm is facing my body. I'm going to stabilize underneath mid-humerus, and I'm going to palpate his teres minor, and I'm going to ask patient to bring his palm up towards the ceiling. Go ahead and bring your palm up. Go ahead. 3 minus, 3. Now I'm going to apply resistance to distal forearm. At the count of 3, resist my motion, okay? 1, 2, 3, resist. 3 plus, 4, and 5. Relax. Patient is 5 out of 5. I'm testing for shoulder external rotation, gravity modified. Patient is sitting, shoulders in adduction. Elbow is flexed at 90 degrees, form is in neutral, and his palm is facing the wall. I'm going to palpate the teres minor, and I'm going to stabilize his middle humerus, and I'm going to ask the patient to move his hand towards me. Attempt to move your hand. There is no motion and no contraction. That's a 0 over 5. Now I'm going to ask the patient to move his shoulder once again. Attempt. There was no motion, but there was a contraction. That's a 1 out of 5. Now I'm going to ask the patient to move his arm towards me again. Go ahead and move. 2 minus, 2. Now I'm going to apply resistance at the distal form. Don't let me push you. Don't let me push your form towards you. At the count of 3, resist me, okay? 1, 2, 3, resist. 2 plus, relax. Patient is 2 plus over 5. I am testing for shoulder internal rotation, gravity modified. Patient is sitting, shoulder is in adduction, and form is in flexion to 90 degrees. Form is in neutral, and his palm is facing the wall, and I'm going to palpate his teres major, and I'm going to stabilize his mid humerus, and I'm going to ask the patient to move his hand towards his belly. Attempt to move your hand. There is no motion and no contraction. This is 0 out of 5. I'm going to ask the patient to move again. Attempt to move your hand towards your stomach. There is a muscle contraction, but no motion. That's a 1 over 5. Now I'm going to ask the patient to move his hand towards his stomach once again. Go ahead and try. 2 minus and a 2. Now I'm going to apply resistance to distal form. At the count of 3, resist my motion, okay? 1, 2, 3, resist. 2 plus, relax. Patient is 2 plus over 5. I'm testing for shoulder internal rotation against gravity. Patient is prone on table, shoulder is in adduction 90 degrees, elbow is at 90 degrees, and forearm is perpendicular to the floor, and palm is facing the wall, that wall. I'm going to stabilize the forearm mid-humerus. I'm going to palpate the teres major, and I'm going to ask the patient to bring his hand, the palm of his hand, towards the ceiling. Go ahead. Go ahead. Through minus 3. Now I'm going to apply resistance. Don't let me. I count of 3. 1, 2, 3. Resist. 3 plus, 4, and 5. Relax. Patient is 5 out of 5. I'm going to be checking for elbow flexion against gravity. I'm going to have my patient standing with shoulder abducted, elbow fully extended, and forearm in supination. I'm going to stabilize his humerus in adduction, and I'm going to palpate his bicep, and I'm going to have my patient fully flex his elbow. Go ahead.
3 minus.
Hold it. I'm going to stabilize distal to his forearm, and I'm going to ask my patient to resist me pushing him down. He currently is at a level 3 over 5. Go ahead and resist me. 3 plus, 4, and 5. He's currently at a level 5 over 5. I'm going to be checking elbow flexion, gravity eliminated. My patient's shoulder is going to be in abduction 90 degrees with external rotation. Elbow is going to be in full extension, and forearm is going to be in supination. Relax. I'm going to stabilize proximal to elbow, and I'm going to palpate the bicep. I'm going to ask the patient to fully flex his elbow. There's no motion or no contraction. That's a level 0 out of 5. Now I'm going to ask the patient to flex his elbow again. I felt the contraction. That's a 1 over 5. Now I'm going to ask the patient to fully flex his elbow.
2 minus. 2.
Now I'm going to apply minimal resistance. Try not to let me push you. 2 plus. I am testing for elbow extension against gravity. Patient is going to be prone on table. Shoulder is going to be abducted to 90 degrees. Elbow is going to be flexed at 90 degrees. And forearm is going to be in neutral position, perpendicular to the floor. I'm going to stabilize proximal to elbow. I'm going to palpate the tricep, and I'm going to have the patient fully extend the elbow. Go ahead.
3 minus.
He is currently at a level 3 out of 5. I'm going to gently unlock his elbow. I'm going to apply resistance to distal forearm. At the count of 3, I'm going to apply resistance. Don't let me push you down, okay? 1, 2, 3. Resist. 3 plus, 4, 5. Relax. Patient is currently at a level 5 over 5. I am testing elbow extension, gravity modified. Patient will be supine on table with shoulder flex in abduction 90 degrees with external rotation. Elbow fully flex with forearm in supination. I'm going to stabilize proximal to elbow, and I'm going to palpate the tricep. I'm going to ask patient to fully extend elbow. Go ahead. 2 minus. Keep going. Keep going. That's a 2. Now I'm going to gently unlock his elbow, and I'm going to stabilize distal to forearm, and I'm going to apply resistance, attempting to bend elbow. At the count of 3, you're going to resist my motion. 1, 2, 3. Resist. That's a 2 plus. Patient is currently at a level 2 plus out of 5 muscle grade. I'm palpating the tricep, and I'm gonna have the patient fully extend elbow, attempt to extend elbow. There is no motion and no muscle contraction. That's a level 0 out of 5. Now I'm gonna ask patient to extend elbow again. Go ahead. There was minimal contraction at the tricep. That's a level 1 out of 5 muscle grade. I will be testing forearm supination against gravity. Patient is sitting, shoulders adducted, elbow is flexed at 90 degrees. Forearm is in full pronation. I'm going to stabilize proximal to elbow at humerus. I'm going to palpate the bicep muscle, and I'm going to ask the patient to rotate forearm so palm is facing up. Go ahead.
3 minus.
That's a grade of 3. Now I'm gonna stabilize distal forearm, and I'm gonna ask patient to resist my motion at the count of 3. You ready? 3, 2, 1. Resist me. 3 plus, 4, and 5. Patient is currently at 5 out of 5 muscle grade. I will be testing forearm supination, gravity modified. Patient will be sitting with shoulder flexion at 90 degrees, elbow flexion at 90 degrees, forearm in full pronation. I'm going to stabilize proximal to elbow at the humerus. I'm going to palpate the bicep, and I'm going to ask the patient to fully rotate his forearm to bring his palm towards his face. Go ahead. 2 minus, 2. Hold it. I'm going to apply resistance to distal forearm at the count of 3. Resist my push. 1, 2, 3. Resist. He is currently at a level 2 plus over 5 muscle grade. For level 0 out of 5, I'm going to palpate the bicep, and I'm going to ask the patient to move his forearm, rotate his forearm so his palm is facing his face. Go ahead. There is no motion and no muscle contraction. Now I'm going to ask the patient to move, rotate his forearm once again so his palm is facing his face. I felt the muscle contraction. That's a 1 out of 5 muscle grade. I will be testing forearm pronation against gravity. Patient is sitting with shoulder adducted, elbow flexed at 90 degrees, and forearm in full supination. I will be stabilizing humerus proximal to elbow, and I'm going to be palpating the pronator teres. And I'm going to ask the patient to rotate forearm so his palm is facing down. Go ahead and rotate. Palm down. That's 3 minus, 3. Hold it there. I'm going to be stabilizing distal forearm and I'm going to attempt to rotate his form into supination. At the count of 3, I'm going to apply resistance. Don't let me move your forearm. Ready? 3, 2, 1, resist. 3 plus, 4, 5. Patient is 5 out of 5, muscle grade. I am testing form pronation, gravity modified. Patient is sitting, shoulder is flexed at 90 degrees, elbow is flexed at 90 degrees, form is in full supination. I'm stabilizing humerus proximal to elbow. I'm going to be palpating the pronator teres, and I'm going to ask the patient to rotate his form so his palm is facing the camera. Go ahead and rotate. That's 2 minus. Keep going all the way that you can. And he's at a 2. Now I'm going to stabilize distal to his form, and I'm going to attempt to rotate his form into supination. At the count of 3, resist, don't let me move you. 1, 2, 3, resist. And he's a 2 plus. Relax. Patient is 2 plus out of 5, muscle grade. I'm palpating the pronator teres for muscle grade 0 out of 5. Attempt to move your form so your palm is facing the camera. There is no motion and no muscle contraction. Now we're going to test for 1 over 5 muscle grade. Attempt to rotate your form so your palm is facing the camera. I felt the muscle contraction, so the level grade is 1 over 5. I'm testing wrist extension with radial deviation against gravity. Patient is sitting with form in pronation, resting on table. Wrist is in neutral and fingers are relaxed. I'm going to stabilize over the form, and I'm going to palpate the extensor carpi radialis brevis and longus at the base of the second and third metacarpal, and I'm going to ask the patient to extend and radial deviate the wrist. Go ahead and come up. 3 minus 3. Now I'm going to apply resistance at the count of 3. Don't let me do it. 1, 2, 3. Resist. 3 plus, 4, and 5. Relax. Patient is 5 out of 5. I am testing wrist extension with radial deviation, gravity modified. Patient is sitting with form in neutral on ulnar border on the table. Wrist is in neutral and fingers are relaxed. I'm going to stabilize mid form, and I'm going to palpate the extensor carpi radialis longus and brevis at the base of the second and third metacarpal, and I'm going to ask the patient to attempt to extend with radial deviate his wrist. Attempt. There's no motion and no contraction. That's a 0 over 5. Now I'm going to ask the patient to do that again. Attempt to move your wrist. There was no motion, but there was contraction. That's a 1 over 5. Now I'm going to ask the patient to extend and with radial deviate his wrist. Attempt to do it. That's a 2 minus 2. Now I'm going to apply resistance. Don't let me push you down at the count of 3. 1, 2, 3. Resist. 2 plus. Relax. Patient is 2 plus over 5. Okay, I am testing for wrist flexion with radial deviation. Patient is sitting with form in supination with wrist neutral with fingers relaxed. I'm going to stabilize the mid-forearm. I'm going to palpate the flexor carpi radialis at the base of the second metacarpal. And I'm going to ask the patient to flex with radial deviate his wrist. Go ahead. 3 minus 3. Now I'm going to apply resistance at the count of 3. 1, 2, 3. Resist. 3 plus, 4, and 5. Patient is 5 out of 5. I'm testing for wrist flexion with radial deviation, gravity modified. Patient is sitting with form in neutral with ulnar border resting on table. Wrist is in neutral, hands are relaxed. I'm going to stabilize underneath his forearm. I'm going to palpate the flexor carpi radialis at the base of the second metacarpal, and I'm going to ask the patient to attempt to flex with radial deviate his wrist. Attempt. There was no motion and no contraction. That's a 0/1. Now I'm going to ask the patient to attempt the motion again. There was no motion, but there was a contraction, 1/5 muscle grade. Now I'm going to ask the patient to flex with radial deviate his wrist. Attempt to move. Attempt to move. 2 minus 2. Now at the count of 3, I'm going to apply resistance. 1, 2, 3. Resist. 2 plus. Relax. Patient is 2 plus over 5 muscle grade. I am testing MCP flexion against gravity for the index finger. Patient is sitting, form is in supination, wrist is in neutral. MCP is in extension and his IPs are relaxed. I'm stabilizing metacarpal bone of index, and I'm going to palpate the dorsal interossei. And I'm going to ask the patient to flex the MCP joint and keep the IPs in extension. Go ahead and flex. 3 minus 3. Now I'm going to apply resistance at the count of 3. 1, 2, 3. Don't let me push you down. 3 plus, 4, 5. Patient is 5 out of 5 muscle grade. I am testing PIP flexion against gravity. Patient is sitting with form in supination, wrist in neutral. PIP is in extension. I'm going to stabilize proximal phalanx. And I'm going to palpate the FDS. And I'm going to ask patient to flex his PIP joint and keep his DIP in extension. Go ahead. 3 minus 3. Now I'm going to apply resistance. Don't let me push you down. 3 plus, 4, and 5. Patient is 5 out of 5. Patient is in the same position. Now I'm going to be testing DAP flexion. I'm going to stabilize over middle phalanx, and I'm going to palpate. Well, this finger is stabilizing and also palpating the FDP. And I'm going to ask the patient to flex his DAP joint. Go ahead and flex. 3 minus 3. Now, resist me. I'm going to try to push you down at the count of 3. 1, 2, 3. Resist. 3 plus, 4, and 5. Patient is 5 out of 5 muscle grade.